Turning right now to our coverage of the coronavirus outbreak tonight. Right now, COVID-19, of course, still sweeping all through Connecticut. But for the first time since the crisis began, states are taking a long look at how and when to reopen.
Yeah, this is going to be quite the process. Connecticut is one of 7 states working together to now develop a plan. Channel 3 Eyewitness News reporter Matthew Campbell is live now with more on what all of this looks like. Matthew.
Yeah, Aaron and Mark, the details, they're still being worked on, but we do know that each state in the Northeast is being impacted differently by this virus. So while everyone is working together, the plans for each state will be different.
Many sidelined from work are at home and getting restless. Money is tight, especially because backlogs at the Department of Labor are delaying unemployment checks.
I know some of them feel a great urgency to hurry up and get this economy going.
But deciding when to get back to normal will be a very tough decision. While the economy does need a jump start, officials need to time it perfectly to avoid a second wave like some Asian countries are experiencing.
In Singapore, for example, infections are up 50%. And they've had to put in place much stricter social distancing a second time around. And that's no good for us.
One look at this chart shows why this is going to be so tough. In Connecticut, we have 3 counties where hospitalizations are rising. The rest actually seem to be doing pretty well, which would suggest they could reopen sooner. But this is why they might not.
If everything's opened up in one county, closed in another, you may, incent people to travel back and forth across the state to buy things or go to a restaurant. And none of that is any good for what we're trying to accomplish.
That logic applies to the entire Northeast region. Today, Governor Lamont teamed up with 6 other states. Each will have a health and economic official develop a plan on when and how states will slowly start to reopen.
What's important, though, is that we share the data and we share what our protocols are.
Pepsi's former CEO, Indra Nooyi, and Yale's Albert Koh will represent Connecticut. While our plan is still a work in progress, here's a look at how reopening the state is being measured.
My number one criteria is A, make sure I have the hospital capacity so I can get people back out safely without risking our hospital capacity, and looking very closely at the infection rates as we build out our testing.
Now, key details of this plan, they're still being ironed out, but it does seem as if some workers will need to be tested before getting back to work. That test is called the antibody, and it's going to detect if someone has already had the coronavirus. That's the latest. Live above the newsroom, Matthew Campbell, Channel 3 News.
Matthew, last week the governor mentioned in one of his daily briefings that the earliest the state could reopen was May 20th. And we're talking here schools, restaurants, bars, etc. Is there any potential change on that May 20th date?
Well, Aaron, it really depends on who you asked. Governor Lamont did not make a mention of changing the date, but President Trump did say he doesn't care what dates governors are throwing out there. He says it's going to be up to him as to when the nation will reopen, and that could be well before May 20th. Governor Lamont went on CNN to say he would not comply with anything like that. Take a listen to this sound, new at 11.
So I'm not going to send hundreds of typhoid Marys out in the community and have another whole round of reinfection. Talk about taking the confidence out of this economy, talking about taking people down. If we let that happen, shame on us. Not one governor will let that happen.
We will be sure to stay on top of this and also ask Governor Lamont a little bit more about this tomorrow in his news conference.